Good afternoon, everyone, and welcome to the COVID-19 update for Monday, November the 2nd. I'm joined today by our Department of Commerce and Economic Opportunity Director, Aaron Guthrie, to talk about the financial support that we're offering to businesses and communities throughout the state as we battle the economic impact of this public health crisis. I'm also pleased to be joined by Tanya Hernandez, owner of Nobias Davila, and Raul Raimundo, representing the Resurrection Project. Today is the first day that resurgence mitigations take effect in Region 6, East Central Illinois, and yesterday IDPH announced that Region 2, now up to a rolling positivity average of 9.7%, will enter Tier 1 of our resurgence mitigations to bring down levels of COVID-19 community transmission enough to once again safely expand indoor capacity for taverns and restaurants and return more kids to school. It's my hope that these temporary Tier 1 mitigation measures will work as they did for Regions 4 and 7 in September and October to lower the number of cases and the positivity rate as soon as possible. The virus is spreading, and every region of the state is suffering from its insidious, invisible contagion. For perspective, this is one of the worst single-week increases in regional positivity across the state since the spring. The lowest increase in any region was 1.2%. That's in Region 5, Southern Illinois. The highest was a 3.1% increase. That's in Region 7, Will and Kankakee counties. Not a single region saw a decrease in the last week. Nothing we can do will immediately reduce the positivity rates or hospitalizations, but our resurgence mitigations are designed to have an impact over several weeks. As long as everyone takes some responsibility for masking, social distancing, and following the CDC and IDPH guidelines. Just like driving a car, when someone blows through a stoplight, they not only risk their own life, but also the lives of all the drivers around them. Right now, the stoplight is red. Please act accordingly. Until we can reduce the upward movement of hospitalizations and bring the rate of spread down, we must keep our economy moving forward and support our small businesses. And I encourage everyone listening to support your local small businesses. These are the heroes who are the lifeblood of our communities, and they're our job creators. Instead of going to a big box store to buy everything, try your local retailer and order lunch and dinner and even a beverage from your local restaurant or tavern. It's how we all can keep each other going. I want to make sure that everyone knows about the actions that I've taken in state government to mitigate the financial impact of the virus on our communities. With the resources that we can afford in Illinois, we're continuing to dedicate substantial support for our state's residents, their families, small businesses, nonprofit organizations, and local governments to help them get through this pandemic. For business owners and communities, I've directed the Department of Commerce and Economic Opportunity alone to deploy $1 billion in economic relief. So what does that look like? Well, in addition to direct community assistance programs, we've offered $270 million for child care providers, $270 million additional dollars in the business interruption grants, $20 million in downstate small business stabilization grants. That's on top of the downstate support coming from the BIG grants, and $14 million in emergency hospitality industry support from last spring. So far, the majority of our 102 counties have received CARES Act funding, with 89 counties receiving business interruption grants and 76 receiving our local government CURE funding. Months ago, in partnership with the General Assembly, my administration focused our federal CARES Act dollars on areas of the economy and necessary human services to reduce the pain that COVID-19 is inflicting. The dollars provided by the federal government aren't nearly enough, so I've simultaneously called for the federal government to deliver more direct assistance for Americans in every state, and I would encourage elected officials across the state to join in on that advocacy. First, for businesses. The COVID-19 economy has been cruel to our workers and our entrepreneurs and their families in every state. Yes, even those that have recklessly chosen not to implement any public health restrictions. Every state has experienced devastating job losses, business closures, and financial hardship. No state has been immune to the virus's economic toll. Here in Illinois, we developed the largest business support program in the nation, a combined $636 million grant program for businesses to cover payroll, rent, utilities, PPE, and other operational costs to keep things moving. Over the summer, we sent out our first round of the business interruption grants to industries hit the hardest by COVID-19, $49 million to more than 2,800 businesses in over 400 Illinois cities and towns across 78 of our 102 counties, more than half of which went to minority business owners. And it's not just business that shouldered new pain in this pandemic. Local governments, too, have taken on new costs in this crisis, from the buying of PPE to supporting overtime pay for essential workers. The $250 million local CURE program is designed to support the more than 1,300 municipalities, counties, fire departments, public health departments, and all local governments in downstate Illinois. Cook and Collier counties received direct allocations from the federal government. That's what we've done so far, and there's more to come. There is a combined $350 million remaining between the BIG, Business Interruption Grant Program, and the local CURE program available right now for local governments and for small businesses. There's $175 million available now for small businesses affected by the pandemic. Applications are open for small businesses of every industry. And we also have specific funding set aside for businesses in disproportionately impacted areas. For more on how to apply, visit dceo.illinois.gov. Applications will be accepted on a rolling basis until the funds are exhausted. In offering this support, we've made it a priority to help the type of businesses that have been left vulnerable by COVID-19. This includes helping industry sectors impacted most by our mitigations: restaurants, taverns, movie theaters, performing arts venues, and other event spaces. We've also provided dedicated programs for downstate small businesses as part of the BIG grant program. We're paying special attention to minority-owned businesses, which, let's be honest, have faced underlying obstacles even prior to the pandemic that have made this crisis all the more damaging. To date, nearly half of our awards have gone to minority-owned businesses. 39% have gone to women-owned businesses, and 49% have gone to disproportionately impacted areas. And Director Guthrie will explain more about what that means in just a moment. If you're wondering what types of businesses have received these grants so far, here are some of them. $46.5 million for 1,898 restaurants and taverns. $9 million for 416 gyms and fitness centers. $3.3 million for 64 indoor recreation venues. $3.0 million for 51 event spaces. $1.9 million for 46 concert and performing arts venues. And as a reminder, nearly twice as many dollars are still available compared to what's already gone out. So the number of recipients will increase substantially as more businesses apply. And I want to make sure we help everybody that we can and everywhere we can. All of that is under our BIG, Business Interruption Grant Program. So let me take a moment to talk about our $250 million local government CURE program. Local Cure is the fund that supports local governments by reimbursing them for expenditures incurred during the public health emergency, such as overtime payroll for first responders or local human services, PPE, plexiglass dividers, and much more. To date, nearly $50 million in funds have gone out to over 206 local government units, with another $31.9 million in process. Again, Cook and the Collar counties received direct supports from the federal government, so these dollars are for towns and other government entities across downstate Illinois. But while over 390 payments have gone out, local government units statewide are eligible, more of them are, but more than 500 of those have not yet registered to receive their funds. This is an urgent call to action to local mayors and city councils outside of Cook and the Collar counties. Submit your costs soon to make sure that your community is getting the local cure dollars that you deserve. Reimbursements get turned around in as little as 1 week. You can contact DCEO to register for these funds, and if you're a resident, call on your local leaders to make sure that this gets done for your community. Our DCEO team has been working around the clock to make sure that nobody is left behind in accessing these programs. That ranges from direct outreach and webinar programs to help everyone fill out the necessary forms properly, to helping businesses that have yet to receive their PPE or were never able to access federal assistance before it ran out. So with that, I'd like to turn it over to our Director of the Department of Commerce for more comments about the BIG program, Local Cures, and other that we're doing all across the state to help businesses and local governments. The Director is Aaron Guthrie.